Good morning or afternoon. My name is Jonathan Neufeld, and I'm the director of the Great Plains Telehealth Resource and Assistance Center. Today, I want to talk briefly about the emergence of generative AI in healthcare and what it means for clinical practice, professional accountability, and the evolving regulatory landscape. First of all, our TRC and Center of Excellence partner organizations appreciate the funding support of U.S. Department of Health and Human Services. Over the past 18 months, we've seen a surge in the development and deployment of generative AI systems, tools that not only retrieve information, but generate human-like text, offer clinical suggestions, and even synthesize patient summaries or imaging reports. Some of these AI products, particularly large language models or LLMs, are being fine-tuned for healthcare-specific tasks. Institutions like Stanford and Harvard are leading some of this charge. At Stanford Center for Biomedical Informatics Research, researchers have been evaluating how LLMs perform on complex medical reasoning tasks and comparing their outputs to those of licensed clinicians. Meanwhile, at Harvard Beth Israel Deaconess Medical Center, physicians like Dr. Adam Rodman and Dr. Ethan Go are exploring how generative AI might transform clinical workflows, from differential diagnosis to managing patient communication. We're seeing remarkable potential. Tools like GPT-4 have demonstrated the ability to pass the UMLE, the U.S. Medical Licensing Exam, to generate plausible clinical notes and provide health literacy appropriate training to patients. Research out of UNC Chapel Hill even showed generative AI models providing mental health coaching scripts with empathy scores rivaling trained clinicians. But here's the catch. Performance is not the same as safety. While these tools can generate highly convincing clinical content, they still hallucinate. They make errors, and they might reflect bias inherent in their training data. Unlike traditional software, generative AI doesn't follow hard-coded rules. It makes predictions based on probabilities. And that makes validation, transparency, and explainability much more complicated because you can't always know exactly where a specific phrase, decision, or line of reasoning came from. And that brings us to regulation. Current regulatory models, whether we're talking about state medical boards, the FDA, licensing frameworks, these are simply not built to handle adaptive generative tools that evolve over time and might be fine-tuned locally and exist in a kind of gray zone between reference and recommendation. This has prompted a lively and, in my opinion, urgent conversation about the structure of regulations in this new context. It's not just about more or less regulation, but smarter frameworks to guide our thinking. For example, how do we attribute liability when a clinician uses a generative AI tool as part of a decision-making process? Should licensing boards issue guidance around clinician responsibility when using AI in diagnosis or treatment planning? And what documentation is needed when an AI system influences care? Doctors Go and Rodman have written eloquently on this point, urging a shift toward what they call AI symbiotic medicine, where clinicians retain full accountability, but systems help scaffold and extend their reasoning. The promise here is enormous, but there's also risk. Generative AI could expand access to expertise, could reduce documentation burdens, could support overwhelmed healthcare teams, and provide tremendous value, especially in rural and underserved settings. But we must not treat these systems as magic black boxes, especially when they're influencing some of the core services that we as healthcare providers deliver. And mistakes here risk harm to patients, erosion of trust, and deepening of health disparities. So we must be cautious, but also informed and proactively engaged with all stakeholders, including regulators, licensing boards, insurers, ethicists, and yes, patients themselves, in designing practices and policies that reflect both technological reality, and also ethical responsibility. So let me close with this. Generative AI is not going away. What we do now, how we guide its responsible integration into healthcare, will shape not just the tools we use, but also the kind of care we deliver. Please plan to join us for the Healthcare AI Bootcamp to learn more. We look forward to seeing you there.